Hi, my name's Paul Rice and I'm a medical massage therapist with Eastern Therapeutic, and today I'll be talking about craniosacral, especially whiplash injuries, where the person has injured their skull, either from a direct impact like walking into a ladder, or falling down, hitting their head, or inside a car, seat belted but getting swung around a lot, or actually hitting their head against the windshield. The consequences of that, the brain is soft and it gets squished, technical term, squished around inside, and thankfully we have some structures inside which limit the motion there, and that's what I'll be working on today. I developed this because quite a few of my customers or clients were damaged in this way. I've been a paramedic, so I've seen a lot more of that type of injury, and so I needed a little bit extra. The standard craniosacral course didn't go into much detail about that, so I had to hit the books. So I'm going to show you a structure which I was given there, which shows what the inside of the brain looks like, the supporting structures. And that's inside our brain, and I'll turn it around a bit like so. So right down the center, left and right, we've got this falx cerebri, and then we have this tent structure. Oh, and the falx goes all the way down, and the spinal cord comes through this little hole here, yeah, like so. So this goes down right underneath the brain, and then we've got this tent structure which separates the forebrain from the cerebellum. So that's what I'm working on. That helps to limit the amount of movement within the skull. So there you are. Let's move it around a bit there. So I could do the whole craniosacral routine, but the pieces that are special to whiplash are dotted around there. So I'm going to jump around a bit, skip over most of it, and just talk about the parts that are directly related to a whiplash type injury. The first routine that I'm going to do is called the Sub-Occipital-Release, and in that I'm going to be holding on to the occipital area with my little fingers, and it's just a little bit of traction with my fingers. It is going to do all the work. It's useful just to complete the whole sub-occipital release routine, and I'll describe what's going on while I'm doing that. Another factor is, from massage school, they said intention makes a difference. So changing over the intention from the sub-occipital release to an occipital tug, that's the difference with the intention and the little finger. So let me start. So lift your head up, please. Thanks. Right. So you get your fingers, base of the skull, and you're pushing in towards the spine. Well, not so much pushing, but just holding that place. And you're waiting for the fascia, the tendons, ligaments to relax, and what happens is that the head then just lays back into the palm of your hand. So right now Crystal's in great shape because the back of the head's in the palm of my hand, but I'm giving her a chance for the tendons and ligaments to release, so that's at least 45 seconds. So I'm just waiting here for that. And when they've released, the next part is to spread my fingers a little bit to add to the loosening effect. The net result of this is the skull and its contents are somewhat freer in their attachments to the spine, and then you just lean backwards and you start to have an effect down the spinal cord in the cervical area. So I spread my fingers, I felt it release. I now get my little fingers on the occiput and I pull back a little bit, just with a final little extra touch to open up that area. So I'm going to do the full sub-occipital release. You're not going to see a lot of action in this video, so that's why I'm talking more. This area is released. I'm just going to lean back, and I'll do this for like 5 minutes or so. So I'll tell you what we were told, what it's like. Imagine you're in a banquet hall, and it's your job to clean off the table, but the lights are out and you don't know where the light switch is, but you know where the table is, so you just go to the end of the table and you grab the tablecloth and you start to pull. And as you gather it up, you notice there's a slight hesitation, and so you have an idea of how far along the tablecloth that is by how long you've been pulling on it, and the amount of hesitation gives you an idea of what it might be. So maybe somebody left a fork on the table or a side plate, and so as you pull it forward, then you find it, and then you keep on pulling, and then you get the next attachment. So it's kind of like that. So there's two attachments, C2 and 3, and then there's some all the way down at the other end, the sacral end. All right, so right now, Crystal's neck is letting go. So I'm just tuning into the feeling of it. I can feel a loosening. All right, and so I could just keep on going for like another 5 minutes to work my way down the spine. But today's class is about whiplash, so inside the skull. So it's at this point I focus more on my little fingers, and I add more of a tug there. So now I'm getting more effect at the occiput. I'm basically pulling on the occiput, which is a difficult thing to do. The base of those structures connect across the back of the occiput. So by pulling on the occiput, I'm pulling on those structures that I've mentioned, the falx and the tentorium. And so the point of this is you challenge it and you wait and you pay attention. So I can still feel a movement, but I'm not paying so much attention to going down the spine, more as I can feel the back of the head moving a little bit, which is the effect I want. If the person had really been damaged by a motor vehicle accident, really suffering, I do this for longer. So it seemed to have slowed down, almost stopped, so I think I'm done on this. Okay, so now I'll move on to the next step. So this involves the parietal. It's a very small area of the parietal that's attached. It's way at the back of the parietal and low down. So if you go to your A&P books, anatomy, that you'll see the area. So I could just jump to the parietal section, but I'm going to do the frontal lift just because it'll help loosen up the parietal so it can move easier. So take my hands off here, and you've probably noticed by now this is a delicate technique, gentle, not much force, and a lot of listening with your fingers. So this will also help when I get to the sphenoid step as well. I find the next step the most difficult of all. So thankfully it's only a tiny little bit of the parietal bone that's attached. So if the person has washed their hair, it makes it more slippery, harder to deal with. If they're bald, perfect, you can really get a good grip. But you can't ask a lady to shave her head for this. The analogy for this is, you think of the roof of a barn and you're trying to lift it by pulling on the top. I'll just take my hands off just to show you the area that's the attachment area. It's down there, right? But I got no grip there. There's no way I can lift it off. So that's why I'm up here, just trying to pull. It's more like you're trying to grab the skin and pull the skin, which then pulls on the skull, which then pulls on what's underneath it. It's a fantastic feeling when you get a release within your brain. I had it done, and it felt like my brain was hit by a wave. It just swung up and swung down and moved around, and the therapist could feel it as well. I could certainly feel it. So it's magical when you get something like that, but don't expect it. Okay, so I pulled on this. Do it for longer if you feel you haven't got a release. Next is the sphenoid compression decompression. So I'm going to loosen the bone and then I'm going to work on the sphenoid. So I compress it first and then I decompress it. So my focus here is just on the bone for the moment, and then I swap over to making the bone move those attachments within the skull. Alright, so I feel that the bone is releasing, and there's a point in there. It seems to be like the focus point. So I dig my finger in, patted my finger in, and focus more on that. You don't want much pressure inwards because that would shorten the connective tissue at the base of the brain. You want to stretch it. So yeah, the fingers tend to slide a little bit. Next, temple bone. There's a large part of the base, the structures there connected with that. And there's 3 parts to it. You have to listen to the CranioSacral rhythm. So I'll be loosening the bone first. Okay. The bones of the skull move in and out with the craniosacral rhythm. The temple bone wobbles a bit, so that's what I'm trying to accentuate. And now to the most important part from the whiplash perspective. You grab the ear and you pull. And this section was what made a difference for me when my brain zoomed around in my head. So everything's gentle. You just pull and you'll feel a connection between the two, which means it's going all the way across the base of the brain. And if you want, you can pull on one and you'll feel it on the other side. And then you pull the other way and feel it back if you want. And you can angle it so that you can pull. If you pull upward, then you're aiming lower down. Base of the brain, underneath the brain. You can angle backwards and, well, let's say upwards and forward a bit, which would then have an effect towards the back at the base of the brain. But anything you do it slowly and wait. There's no harm on doing this to a person who has no injuries. The tissues are there to adjust to the stresses, and so they'll release and go back to what they were. There's so much you can do with the ears, because by choosing the direction you're pulling on, the opposite line is what you're affecting. So pulling backwards, you can have an effect in and around the eyes, into the nasal canal, along the nerves feeding the ear for hearing. So in the case of whiplash, if somebody wasn't seat belted and their face hit the windshield, then you'd be doing this technique for a bit longer, because there'd be all sorts of tightnesses that would affect the facial area. So you'd just be aiming, to reach those, and you'd probably be holding onto the nose, helping to pull in the opposite direction. So I've been pulling on her ears in different directions, so I can get the back of the base of the brain, the middle of the base of the brain, the front of the base of the brain. So you may find this one takes longer than any of the others. Now I'll go on to the next final step, which is to do with TMJ, where I'm doing the jaw. What you may have noticed so far, if we go back to this diagram, is I haven't mentioned anything about these structures, the top and the bottom. And because how can you grab this thing that goes down the centre of the brain? You grab the hair. So this is how you do it. You get underneath the jaw and you bring it towards you. So there's a whole bunch of things happening here. First, the jaw moves. And because of our anatomy, as the jaw tries to go higher, it pushes on the temporal bones and pushes them outwards, which is a good thing, because connected to the temporal bones is all those fascial structures, the base of the brain, which we want to stretch. So this, because I'm going to do this for quite a while, it can get uncomfortable, so afterwards it's essential to release the jaw and to pull it downwards again, because it's being pulled up. Job number one, lift the jaw up, pushes on the temporal bones, pushes them outwards, stretching what's in between. As you continue to pull the jaw upwards, now the entire skull is being lifted. And what's attached right to the centre, midline of the skull, but a falx, which connects all the way from top to bottom. So eventually, by pulling on these skull bones, the only thing that's tight is that falx, which runs right through the center. So after a while, I'm pulling on the falx. And it's slow, you wait, and you'll feel releases at times. And if your fingers are sensitive enough, you'll have an idea where those releases are occurring. And for those of you out there who are sensitive to such things, you may feel it within yourself, what's going on with the other person. One thing that's a common oops is you try too hard, you try too fast. I do it as well. And so if you find that nothing's happening, ease up on any of these techniques. 5-10 seconds later, things will start to move again. If you force it, the body will stop you. Those connective tissues will not let you damage the person. It has to be gentle, it has to be slow. So you do this until you feel that nothing's happening, or sense that nothing else is going to change in there. And then, because you've been lifting that jaw for a while, you really need to push the jaw back down. So you grab the jaw, and it's a two-part thing. Push it down, and when it's released, then you push it forward. So you see my hands change position. So why would you do this? You do this when the person's brain function has become confusing to the person. They're like a zombie. Their memory's affected. A whole bunch of stuff just isn't working, because this structure goes deep inside the brain. So can affect the deeper structures like the emotional control, temperature control. So everything's up for grabs in terms of what can be affected. So after this, what you're looking for is the person's mentality to return to what it was before. They're no longer fuzzy, headaches, confused, stumbling around. So that's CranioSacral, with a specialization in structures within the brain for whiplash, head injuries. It can even be falling off a horse and landing on your butt, because everything's connected. The shock in that case would be of the brain sinking down and then bouncing up. So again, that tent would take the force and then spring up again. Thanks for watching. If you like this video, hit the subscribe button, because that'll let me know that you want more of stuff like this. Thank you.